Good afternoon, everyone. Thanks so much for joining us today. Happy Friday to everyone. Today is day 5 of our Georgia HFMA Virtual Spring Forum. I want to thank all of you for your participation today and this week. I hope it's been valuable information for you. We're going to give it just a minute here. We've got some people that are continuing to join, and we'll get started here momentarily. So settle in, get comfortable, and we've got 2 sessions today. As you might remember, we've got Peachstate, which is talking about Ambetter today. We've got Peachstate from 1 to 2, and then from 2 to 3, we've got Humana lined up. And unfortunately, I will need everybody to exit and enter back in through the link that's unique for the Humana call at the end of this call. But even if we finish a little bit early, we'll still stay on schedule for the 2 o'clock Humana call. So let's give it just a minute here. Blanca, thank you for your patience. We've still got some people joining as we get going here. And you're still on mute. You're still on mute. There you go.
Hear me now?
Now I got you.
Okay, good. I dialed into my cell phone because the computer system may shut down at any time. You just never know with these things. So
no, I hear you. I hear you. Yeah, that's fine. Let's give it just a minute. I'm seeing the number of participants picking up a little bit, so I think we still have a few people that are dialing in. We'll give them just a second.
Awesome.
Thank you for that.
Yeah. And so we will have everyone put their questions in the chat, and then we'll answer them at the end. Is that okay?
Yep.
Okay.
Yep. I'm going to share that here in just a minute. So I think we can feel comfortable getting started. So everybody, again, welcome to the 1 o'clock session. We're happy to have with us today Blanca Rodriguez, who is a Senior Manager Provider Network with Peachstate Health Plan. She's going to talk with us today with some updates on Ambetter. I want to encourage all of you to please submit any questions that you have through the Q&A section at the bottom or on your phone or wherever you're listening from of the Zoom page. And I will ask Blanca those questions as they're appropriate, or we'll hold off some of them until the end. So with that being said, Blanca, I'll go ahead and turn it over to you. Thank you so much.
Awesome.
Go ahead and share your screen to make sure we got that part working.
Okay, absolutely. You have to enable it. It's disabled right now.
Okay.
That's host disabled screen. All right, I'll try again. Here we go. Okay, can you guys all see my screen?
We can see you. Yep.
Let me get this situated here.
Perfect.
Okay, so we got this on the screen. Good afternoon, everyone. My name is Blanca Rodriguez Russell, and I have been with Peachstate Health Plan for 13 and a half years. I manage all products on the provider relations side. So that would be Ambetter, Medicaid, Medicaid, and then Medicare All Well. Today we will be talking about Ambetter a little bit from the launching of Ambetter in 2014. Nothing too much has changed, but we would like to give everybody an overview in case you have any questions or you are new to a new provider joined our network on the Ambetter side. So I will start now. Okay, a little overview of who we are. So Ambetter from Peachstate Health Plan provides a market-leading affordable health insurance on the market insurance marketplace. We are definitely a certified, qualified health plan insurer. Ambetter delivers high-quality, local-based healthcare services to all its members, with our providers benefiting from enhanced collaboration and strategic care coordination programs that we have built in, and they have all become much more robust over time. The purpose of our Ambetter insurance was to increase access to quality health insurance and improve affordability, dependent coverages until the age of 26, pre-existing condition insurance plan, no lifetime maximum benefits, preventive care covered at 100%, and ensure a minimum loss ratio of 80% for any individual coverage. Reform of commercial insurance market. Ambetter also has no more underwriting, which guarantees guaranteed issue, tax penalties for not purchasing insurance, minimum standards for coverage, benefits, and cost-sharing limits, and subsidies for lower incomes that fit within the income bracket. Online marketplace for purchasing our health insurance. Members can register, determine eligibility for all health insurance programs, including Medicaid. You can shop for all plans, enroll in a plan. Exchanges may be state-based, federally facilitated, or state partnership. Georgia is a federally facilitated marketplace. The health insurance marketplace is the only way to purchase insurance and receive subsidies of any kind. Subsidies come in the form of APTC, which is an advanced premium tax credit, or cost share reductions. All benefit plans have cost shares in the form of copays, coinsurance, and deductibles. Some members will qualify for assistance with their cost shares based on their income level, and the assistance will be paid directly from the government directly to the member's health plan. What do we need to know? All right, so this is just key contact information, which can also be found on our provider web portal, which is the unsecured side. These are just some phone numbers if you wanted to reach or required to reach Ambetter, the phone numbers and our website if you needed to speak to someone regarding Ambetter. All right, so all of our new providers that join the Ambetter network will always receive what we call a welcome packet. It's a provider toolkit, which will entail a welcome letter. It will have an Ambetter provider introductory brochure, how to set up on the secure web portal, which will be highly recommended. There you'll be able to validate a lot of great information, plus submit claims and so forth, which we can get into that as we move on. Electronic funds transfer, a prior authorization guide. You will receive a quick reference guide and a provider office window decal. Provider manual is our comprehensive guide. As we know, our provider manual ties to your contractual obligation with Ambetter. And so you can find anything you need on there: network information, billing guidelines, claims information, regulatory information, quality initiatives, and more. Down here is our website to be able to just go and you can access that without having to log into the secure portal. This can be found on the unsecured side under provider resources. Provider relations plays a pivotal part once a provider comes into the network with us. You will have a dedicated team that helps perform everything that's executed in your contract as a provider joining our Ambetter team. So your provider relations will be your go-to person to help with any credentialing issues, enrollments, submittals, any claim inquiries. Many times JOCs are set up as a monthly practice to be able to have discussions in a more smaller setting to iron out any issues or concerns you may have that require a more different level of review. So this just kind of breaks that out. Please, if you don't know who your provider relations representative is, we have a territory list that is out on our web portal that will allow you to see from a county perspective or from a facility or hospital or group perspective who your dedicated provider relations representative is to be able to assist you. And this is pretty much what I just said. Everything that you will, with your provider relations, can help you with, from contract clarification to assisting with your portal registration, provider education, quality, and all of those things can be provided to you and can be given to you through your provider relations specialist. And this is just our link, just to show you how to get to our web portal without having to sign on to the secure side. So The unsecured side, as I mentioned various times, these are the items that you can find without having to log in on the secure side. You can access our provider billing manual. There are quick reference guides. There are all types of notifications, prior authorization fax forms. You have a pre-authorization tool, which I highly recommend, that you are able to access and submit the CPT code that you'll be billing to see if it's something that requires a pre-authorization before performing your service. And if it does require something, it will allow you immediately to submit for a prior authorization right there while you're on the pre-auth tool. Pharmacy, there's also a PDL listing there and so much more. There's a lot of great information on the unsecured side, payment policies, and just great resources that you're able to get and go through without having to sign on to the secure side. So the secure provider portal, it just shows you here a little snapshot of how to create an account, which is super easy. Literally, you're creating, when you click on that little yellow create an account, it's just going to ask you for a series of information, a email, and that's how you'll be able to access the secure portal via your email and a password. A link should be sent to your email. You will validate your email through that link, and then you will have full access to your secure side. So what's on the secure side? The secure side will allow you to do member eligibility, and I'm speaking more so for just Ambetter only, where you can validate member eligibility. You can access the member's health records and care gaps, any authorizations that are already on file or have been, claim submissions for that member and status of those claims. Any corrected claims can be performed on there. Claim submittals can be performed on there. Authorizations can be created on here. Payment history. You can access monthly PCP cost reports, and also PCPs can access their membership on here as well. Provider analytics reports are found on here. Everything that you can think of your claims submitted day of, different tax identification numbers that you will be managing to can all be seen on the secure side. And this is just links that show you how to get, once you have your portal privilege, what you can get, your kind of reports that you can access, emergency room utilization reports, and so forth on the secure side. Okay, so now we have member ID card. So this is what our Ambetter member ID card looks like. Just the front will always have the little magenta Ambetter circle right here, which says Ambetter from Peachstate. You'll have all of the members' information here. And here you should also have, let's see, the kind of plan they have, any deductibles, co-insurance, PCP, co-pays, and things of that nature will all be outlined in the member's card and can also be validated on the secure side of the portal. And then the back, your traditional numbers to reach out to the plan if you needed to, if you needed further assistance or from a member provider services representative. It is always recommended, as we know, that providers always validate eligibility at the time of scheduling an appointment, and of course, when the member comes in for the appointment. I recommend that you look at the card and get an ID, just to make sure that you are aware of the Ambetter, the type of Ambetter insurance the member is carrying, just to be sure for your own self that when you're creating the appointment, that the member is still active at the day of. This is just our eligibility, benefits, and core shares can be verified in 3 ways. You can go to our Ambetter secure portal and you can validate eligibility there, or you can call our customer service, provider services representative, and we also have a 24-hour interactive voice responsive system that you can also enter the member's ID, and it will also provide you member eligibility at that time as well.
Blanca, I have a question that just came in. If I could ask that, please.
Sure.
This participant indicates that they have found there's a lot of confusion between the Ambetter marketplace cards and the Peachstate Medicaid cards due to both of them being relatively similar. I don't know if you've heard that or not, but are there any plans to improve the distinction between the two plans?
I think the distinction for right now is that Ambetter has this magenta color. So let's go back for a second. And I wish I had it. And Peachstate will just be just this by itself. Peachstate Health Plan Medicaid is just going to be the peach. And it's just really going to be, it really won't have this much type of information, as we know that a Medicaid member really wouldn't have all of these different types of copays, deductibles, or what have you. It may have like $1 or $2 type of copay, but Peachstate, it'll just be just Peachstate. This will say Ambetter from Peachstate, so we know it's Ambetter, and the card has this magenta color, and the Peachstate always has the orange, and our Allwell has a purple, like the grape. So it'll say Allwell in a grape little bubble here with Peachstate, and then it'll have all its information there. But we used to get we used to get a lot of issues with that, but I think now with the Ambetter magenta color and also populating this little icon right here on the card, I really don't get too many eligibility issues or confusion with it. Just okay. More so people just requiring like, what is the plan? What kind of Ambetter plan is it? Something like that, which you're able to validate a member's plan on the secure side.
Okay.
Yeah. Does that help? Did that response help?
I asked, and we'll see how they respond. Yep.
Okay.
Thank
awesome.
you.
Yes, absolutely. So guys, this is what the secure portal looks like when you log in. You log in, and then you're able to, do eligibility checks. You're able to see your patients, your patient membership here. Authorizations are performed here and reviewed here. Claims submittals are performed here. Corrected claims are performed here. You can also see the claim status here. Messaging is just between you and our provider services team. So if you send something, it'll go secured and they'll come back to you. Again, if you know your provider relations representative, you can reach out to them to assist you as well. Here where it says plan type, please make sure that you're also drop downing that menu and that you're selecting the appropriate plan type. Medicaid will have a tab, Allwell has a tab, Ambetter has a tab. Because what happens if you don't change this here, the plan type, and you don't have the appropriate TIN that's going to be billing or providing the services for the member, and you put this eligibility check here, the member may not come up. So if it's on the Medicaid mode and you put in an Ambetter member, it's not going to show you anything. So just make sure that these two are dropped down and selected appropriately so you can get what you need. So in this example, with the green thumbs up, it says this member is available and eligible at the time of service, and so this is a good to go. And it'll also show you any care gaps that the member may have and services that the member is required and overdue for as well. And basically what I just kind of broke out to you guys, cost sharing and everything here can be reviewed on the Ambetter eligibility. You are able to see members' deductible, co-insurance, co-payments, and that. It'll also show you where they are today with their deductibles and things of that nature. You can also see their health records, authorizations that have been submitted prior to, a provider seeing them, things of that nature, any PDLs, referrals that may be given to the member, any coordination of benefits, claims that have been submitted for this member already. And then here, their summary of benefits. It's probably in this presentation, but the summary of benefits are going to tell you what type of benefits the member has that's tailored to them. Very important, because it will also help you understand, like, if this member had an Ambetter balance care, what kind of benefits do they have? And like for therapy services and things like that, which is what I just said. Here's the summary of benefits. When you click on that, and then you go here to this little hyperlink, it will take you to, let me see if it's showing. Nope, it doesn't. It's gonna take you to their specific benefit plan. And it just kind of breaks out visits, how many, co-payments, specialist payments, and things of that nature. So it's really good if you really want to know in detail what type of benefit plan for and better the member carries. When our members need to visit a specialist, know that we educate them to seek care with their PCPs first. However, when medically necessary, beyond the scope of a PCP, they should be initiating with their PCPs, but paper referrals are not required when a member sees an in-network provider, a specialist. So a paper referral is it's not required, but the provider does have to be in-network. And this is just how to access our prior authorization forms, and there are 3 ways that you're able to submit one. You can do it on the secure web portal, you can phone your authorization request in, or you can fax it over. And this is the pre-authorization tool that I spoke about. You answer these little series of questions here. If you select emergency at the top, there'll be nothing else to ask. As we know that from an emergency standpoint, an authorization is not required until the member becomes inpatient. So that's a whole different, level. That's a whole different thing that this would not be on here. You can access this here. This is a CPT code authorization tool. You prompt to put your CPT in this bar. You click check, and it will let you know if the CPT does or does not require an authorization. This is just our normal, this can be found in our provider manual, just things that do require procedures that need a prior authorization will be anything potentially cosmetic, MRI, an ultrasound, and it just breaks out to you how many ultrasounds are accepted, urgent, emergent ultrasounds, and pain management. An inpatient authorization is needed for the following. All elective scheduled admission notifications requested at least 5 business days prior to the service being performed. Observation stays that exceed, I should say 24 hours, but observation stays that exceed 24 hours will require an inpatient authorization. That is out in our provider manual. I need for someone to update this because it's not 23 hours, it's actually 24. Actually, observation stays exceeding 48 hours. My apologies. It's actually 48 hours. Observation stays exceeding 48 hours will require an inpatient authorization. That is out on our provider manual, and you don't need to log in to see that. That's on the unsecure side. Urgent, emergent admissions within 1 business day follows the date admissions. Newborn deliveries must include birth outcomes, and partial inpatient, and intensive outpatient programs will require authorization. And this just breaks out ancillary services. Again, all of this can be found in our provider manual, just home health, adult medical daycare, hospice, and DMEs, and so forth. This is just our little prior authorization time frame bracket. Very helpful, also found in our provider manual. Highly recommend that you guys look at it. It just gives you like the service type and then time frames to turn around an authorization, like it's scheduled admissions. We said 5 business days prior to the scheduled admission date. Any elective outpatient services, prior authorizations require 5 business days prior to the elective outpatient admission date. Any emergent notification within 1 business day. And look, this one says what I was saying. Observations 48 hours or less. Notification within 1 business day for non-participating providers. Observations greater than 48 hours will require an inpatient authorization within 1 business day. Emergency room post stabilization, urgent care and crisis intervention, 1 day. Maternity admissions, 1 day. Newborn admissions, 1 day. NICU, 1 day. And outpatient dialysis, 1 day. All of this is found in our provider manual and accessible under provider resources on the unsecured side of our web portal. This also gives you the breakdown of prospective urgent, a 1 business day turnaround, anything non-urgent, a 2 business day turnaround, emergency services, a 1 hour turnaround, concurrent urgent, 24-hour turnaround, and retrospective, 30-day turnaround. Again, all of these timeframes and bracket timeframes is also found on our provider manual for your convenience. Prior authorizations will be granted at the CPT code level. So if a claim is submitted that contains CPT codes that were not authorized, the services will be denied. If additional procedures are performed during the procedure, the provider must contact the health plan to update the authorization in order to avoid any claim denials. It is recommended that this be done at least within a 72-hour time frame of the procedure. However, it must be done prior to any claim submissions or the claim will deny. Ambetter will update authorizations, but will not retro-authorize any services. The claim will deny for lack authorization if the extenuating circumstances that led to the lack of the authorization, the claim may be appealed. So please understand, this is just a very open process that what we have in place in our provider manual, but we know that there will be emergent circumstances where a provider was scheduled to do a surgery and X, Y, and Z was going to perform, and then something else may happen, and other things need to be performed that weren't initially outlined and, of course, not authorized prior to, as we wouldn't know that those things can arise. But upon all of those procedures and additional things that may have been required, of course, for our member to have a successful outcome, that will be called in as soon as possible, and then your authorization can be discussed with the utilization management, and they can go ahead and update anything else that required to be done for the provider. So just know that this is just a preliminary of how things go from a retro authorization perspective, but in the event something emergent arises, of course, there's other avenues that can be taken. Clean claim. A clean claim is received for adjudication in a nationally accepted format in compliance with a standard coding guidelines and does not have any defects, improperly lack of any required documentation, or particular circumstance requiring any special treatment that prevents timely payment. Are there any exceptions? A claim for fraud where fraud is suspected, or a claim for which a third-party resource should be responsible. Claims can be submitted to the plan in 3 ways. You can submit a claim through the secure web portal, through your clearinghouse, or you can drop it to paper and send it in. And this will be the mailbox to submit any Ambetter claims. Each product has their own PO box, so please be sure that you're submitting an Ambetter claim to the appropriate PO box, which can be found also in the provider manual in case you didn't have it. Claims, reconsiderations, and disputes. For reconsideration requests, providers can use the reconsideration claim button on the Secure Side portal. A written request from the provider about a disagreement in the manner in which a claim was processed, no specific form would be required. Must be submitted within 180 days of date of payment. And you can mail in any reconsideration or, send in any documentation that you want to reconsider a claim that you are not happy with the disposition of it. And that has a reconsideration PO box of its own. Again, claim disputes must be submitted within 180 days of your EOP, which is the disposition of the claim payment. A claim dispute form can be found on our website, or again, you could submit it to our claim portal. It will just populate all the information for you and you can submit it, which at that time, it will give you an ID number, a reconsideration ID number, which will allow you to know that it was submitted successfully and that we have received it. Let's see here. So did we miss something? Because it looked like it just jumped right to ACA. Okay. I see that there's a question. Is there anything, Bill, is there a question for me?
I'm sorry, I was on mute. Patient comes in for an arteriogram, which doesn't require authorization. Patient has arteriogram and a blockage is found requiring a revascularization procedure. We are calling the day of or day after the procedure for an updated authorization, are being told we can't obtain post-procedure, but must allow the claim to bill out for a denial, and then we can appeal. Do they understand the process correctly?
That sounds pretty accurate. You want to submit the claim and let the claim deny, and then you want to appeal with any medical records to go ahead and support what you were billing. You're going to bill for those services, but you want to also have your medical records be sent in and reviewed for the additional services that were performed. So yes.
Okay. All right.
All righty. So I think this may be missing an additional thing, or maybe not. I don't know. But it looks like what we're going to go into now is a member who has the APTC, which is the Advanced Premium Tax Credit, and why this is so important is because any member that does have the APTC will always be allotted the 3 months, what we call a 3-month grace period for paying claims. So if I have an APTC credit, then let's just say it's January, I wasn't able to cover my premium, I will not be terminated at the end of the month. I'm going to be put in a suspension status, which you will be able to see that on my file when you check my eligibility. And it's going to allow me a 3-month grace period to go ahead and pay for my premium. And which at that time, if I had any services rendered in between those times, my claims are going to pend. And those claims are going to pend until the 3-month grace period is over for me. Which at that time, if I make a full payment for all of the 3 months that I would owe, then all of those claims will process and pay. But if I don't, and then I'm termed as a member, then those claims that were pending are going to drop, they're going to adjudicate, and then I'm going to get a bill. That's going to now be my responsibility, and I'll have to be self-paid. So that's really what this is kind of breaking out. When a member's in suspended status, when the premium is paid by the members, that the claims get released and adjudicated, and if the member doesn't pay, then the provider may bill the member directly, which is what's going to happen. This is just a little breakdown and a little example of what I just said. So basically, the member has to pay their premium January 1st and didn't. February 1st, premium was due, member didn't pay. March 1st, members placed on suspension status, which you can see that on the eligibility tab. It's going to be in big, bold letters. And then April 1st, the member remains in a suspended status because they probably haven't paid yet. May 1st comes, and then the premium remains unpaid. The member is now terminated, so now the provider will now move forward to bill the member. Seeing the member during suspension status is totally a business decision for you guys. That is up to you guys if you choose to see the member or not. Just know that those members do get a 3-month grace period to go ahead and pay for their claims. So anything done in the suspension status, those claims are going to pend, and they're going to pend an LZ. And then at that point, after the 3rd month grace period is over, either they paid for everything and all those claims processed and pay appropriately, or they don't pay and they get terminated, and then the provider will have to bill the member. Do we have a new question? Yeah, and Lynn, to your response, I mean, if you have a provider relations representative and you want to forward them an example where you're kind of not bridging the gap on going to get those authorizations for any services that were not previously supported for or authorized for, you can definitely send those over to your provider relations rep, and they can take a deeper dive to see if there's anything that can be done, or if there's something initially not being done, or are you guys calling in to get these services retroed in And then at that time, you can provide your medical records and things of that nature. But you can definitely have somebody review that in a more deeper level for you. Okay, just some things that we require when billing a claim, just to prevent any type of rejections. A claim and better claims have to be billed with your taxonomy code. If it does not, your claim is going to reject. Reject meaning it's not going to make it into our system, not a denial. Where the claim actually does make it in and then it denies, this will actually reject front end. So please be sure that you guys are appending your taxonomy code appropriately on the claim. If you're billing any lab services, we all know that a CLIA and active CLIA number should always be billed in box 23 of your claim, and that it will appropriately loop our EDI system into to pull in that CLIA number and validate for activeness. If a lab was performed and the CLIA number was not appended on the claim will deny for CLIA. Or if a CLIA number was added, but the CLIA number is expired, the claim will also deny and it will say that the CLIA number is invalid. Billing the member, co-pays, co-insurance, and any unpaid portion of the deductible may be collected at the time of service. Deductible information, including the amount that has been paid toward the deductible so far, can be accessed via the secure portal. If the amount collected from the member is higher than the actual amount owed, upon claim adjudication, the provider will reimburse the member within 45 days. PayFan is our EFT partner. So if you guys are already, if you already are set up with PayFan for let's just say Medicaid and you just join the Ambetter network, you don't need to do anything except just let PayFan know that you now have joined the Ambetter network, and they will tie that into your existing login. So that this way you don't have to do anything additional. You can just go ahead and just sign in and be able to see the products that you participate in. If you don't have a PaySpan account and you'd like to, here is the PaySpan link, and you are able to go and just register, and they will work with the provider to get you set up. This will be for EFT payments. Claims, a provider must exhaust the claim reconsideration and claim dispute process before filing a complaint or a grievance appeal. Complaint grievance must be filed within 30 calendar days of the notice of action. Upon receipt of complete information to evaluate the request, Ambetter will provide a written response within 30 calendar days, of course, to the provider. For claims, the claim reconsideration, claims dispute, and claims grievance process must be exhausted prior to filing appeal. Medically necessity claims must be filed within 30 calendar days from notice of action. Ambetter will acknowledge that with providing the provider within 10 business days, a communication just letting you know that we received the appeal. Ambetter shall resolve each appeal and provide a written notice as quickly as possible regarding, well, of course, if it's something that needs to be escalated immediately, it will not exceed 30 calendar days for the member, of course. We stay within a 72-hour time frame if this has anything to do and can seriously jeopardize the members, if it's a life or death situation, of course. Those types of appeals are reviewed immediately and a decision is responded to immediately. Member representative, a member can ask a provider to act as their representative to file an appeal related to a medically necessity claim that Ambetter requires that this designation by the member be made in writing and provided to Ambetter. No punitive action will be taken against the provider by Ambetter for acting as a member's representative at any time. For any more information on this, you can find that also in our provider manual. There's a whole link and a form out there that you guys can use to protect yourself if the member has asked you to please assist with an appeal. And these are just our vendors that we use, NIA, for any imaging services involved for our vision, dental and wellness for our dental services, pharmacy is involved pharmacy solutions. All of this information can be found on the unsecured side of our web portal. And that brings me to the end of my presentation. So does anybody have any questions?
Thanks so much, Blanca. Everybody,
Yeah,
what other questions do you have for Blanca? As you've seen with most of the payers this week, there are a number of online resources. Give us any feedback, if you can, on your ability to connect with these resources consistently, and that they've been helpful in helping you resolve issues that you're having, claim status, that kind of thing. Anything that Blanca needs to know to share with her team would certainly be very helpful. But at this point, we'll open it up for any more questions or comments that you think would be beneficial to the group. We'll give it just a minute here.
Yeah, absolutely.
Let me give it just a minute. And I'm putting something in the notes here too, just for this next session. Let's see. Yep, I don't see any other questions coming in.
Yeah, I don't either. I'm looking just to make sure we didn't miss anybody.
Yeah, no, but I'll be sharing the presentation with all of you. And certainly if you have any issues, you can reach out to Blanca and anyone else at Ambetter. Feel free to always use me as a resource. I'll help to connect you with the right people if I can. I'm not the call center, but I'm happy to help any chance that I get. And I wanted to let everybody know that in the chats, excuse me, in the chat section, I just put the meeting ID and the password in there for the Humana call scheduled for 2 o'clock. And Blanca, I just want to thank you so much. You continue to be very supportive of these events and of Georgia HFMA. We appreciate the work that you do on behalf of the providers across the state, and hope that we can continue the partnership so that we can figure out a way to maybe eliminate some of the rework and administrative burden that some of these providers are experiencing across the state. So.
Absolutely. And please know that there's a provider territory list out there on the unsecured side, and that is pivotal. There's managers, directors, VPs, everything is outlined for the provider relations side. So if you're not getting what you need from your dedicated provider relations, please reach out to managers or even directors. We definitely want to be able to ensure that you guys are getting your answers, your questions answered, and your emails, timely reviewed and all that. Any confusion that you may have in the Ambetter world, we are here to definitely support and help you as much as we can, guys. Yeah,
I appreciate it so much. So
thank you.
Blanca, we thank you, and thank you everybody for your participation this week. As a reminder, we do have another session starting at 2 o'clock with Humana, and we hope that you'll be able to join us for that. If not, have a great weekend, and we'll look forward to hearing from you or seeing you at another Georgia HFMA event real soon.
Absolutely. Everyone have a wonderful weekend. Thank you so much for joining.
Take care, everybody.
Bye.
Bye-bye.